Thank you so much. Okay, so I start again. Good afternoon, everybody, and very warm welcome to our pivotal webinar, International Vanguard webinar, organized by the Stakeholder Group on Aging in Africa. The theme, as you all know, is positioning Stakeholder Group on Aging for impact delivery for older persons in Africa. Our aim this afternoon is to reinvigorate advocacy and partnerships for the rights of older persons and their inclusions in Africa in terms of policies and actions. This afternoon, our session promises to be an illuminating one, an experienced, inspiring one as well. If you look on your screen, the aims are very simple and straightforward. There are about 5 of them. As we all know, advocacy for aging in Africa faces a complex situation with significant progress, which is being made at the regional level. We must acknowledge that. But nonetheless, the challenges still remain, especially in translating these efforts into effective national policies and programs across the continent. While the African Union has taken steps to recognize older persons' rights, many African countries still lag behind in developing and implementing comprehensive national strategies on aging. We believe that this webinar this afternoon will be an opportunity to invigorate partnerships between SGA Africa and the global community, including your different organizations, UNDESA, African Union Commission, UNECA, on all aspects of aging, in terms of meeting challenges and exploiting opportunities. We will be joining forces. We hope to join forces with the Network of African Institute of Human Rights and GAROP to gather inputs to negotiate Africa's positions on thematic issues during the drafting of new conventions on rights of older persons. Before I call on our experts panel to help us digest and unpack the different objectives of our session today, let me let you know that the chat room is open and it will be monitored. All questions can be dropped there. If you have any comments to pass, you can also raise up your hands. The session this afternoon will be divided into like 4 different parts. We have the opening with goodwill messages and special remarks. We also have the panel discussion itself. We have about 4 expert panelists to help us there. And then we will open up for questions and answers. And then there'll be another round of questioning to our panelists before we wrap up and then close the seminar. But we aim to leave this webinar today with pungent key messages that we will be able to use across in advocacy. So welcome everybody. Thank you so much. I don't know if I have somebody online who will be helping me. I don't know if she's here. Nonye, are you online? So in case anybody has any technical issues, she's around to also help.
I am.
Are you here?
Yes, I am.
Okay, good. So let me start with our first. Can you see my screen?
Good afternoon.
Are we able to see my screen?
Yes, we can.
Okay.
Yes, we can.
Okay, so our first speaker today is Amal Abu Rafa. She's the Chief of Aging Program UNDESA, and she was represented by Aliye Mossad, who is the Social Affairs Officer and program on aging section, social inclusion and partnership and participation branch of UNDESA. That's the Department of Economic and Social Affairs. Okay, I think technology is now failing me as well.
Department of Economic and Social Affairs in New York. It's a pleasure to contribute this message to the SGA Africa Vanguard webinar, focused on positioning the Stakeholder Group on Aging for stronger, more effective impact in Africa. This is an important opportunity to reflect on shared progress and to look ahead at how we can better advance the rights and well-being of older persons across the continent. Today, I will share highlights from the fourth review and appraisal of the Madrid International Plan of Action on Aging, or MIPA for short, with an emphasis on Africa, and outline the roadmap for the fifth review and appraisal cycle, which runs through 2028. The fourth review and appraisal concluded with the global review in 2023 during the 61st session of the Commission for Social Development. This process unfolded in the context of the COVID-19 pandemic, which amplified long-standing disparities and exposed serious gaps in protections for older persons. In the African region, the fourth review and appraisal, coordinated by the Economic Commission for Africa, offered an opportunity to take stock of both progress and persistent challenges. The review drew on national inputs and regional perspectives to better understand the lived realities of older persons across the continent. There were several key themes that emerged. First, access to healthcare remains limited. Only 45% of older persons live near a healthcare facility, and around 40% reported being unable to access medical care when they needed it. While some countries have introduced exemptions and expanded healthcare coverage, the reach and quality of services remains uneven. Mental health services in particular are rarely available, and the prevalence of mental health conditions among older persons is not well documented. As a result, mental health remains significantly underrepresented in policies and programs across the region. Social protection systems are also insufficient. In 2020, coverage in Africa was estimated at just 17%. Now, though this number masks significant variation across subregions, that's still quite a low number for social protections. Older persons, especially women and those working in informal economies, are often excluded from pensions or income support. Despite these gaps, older persons remain key contributors to society, serving as our caregivers, our community leaders, and bearers of cultural knowledge. Yet their roles are too often overlooked in national policy frameworks. Opportunities for participation in policymaking also remain inconsistent. While a few countries have strengthened consultation processes, there are many that still lack the structures needed to ensure meaningful engagement of older persons in shaping the decisions that will affect their own lives. Disaster preparedness and climate adaptation strategies too often tend to overlook older persons, despite growing evidence of their heightened vulnerability during crises. At the same time, gaps in age disaggregated data continue to limit the ability of policymakers to plan, monitor, and respond effectively. Without robust data, older persons risk being left out of the picture altogether. Still, there are encouraging examples to build on. Senegal has developed a national platform for older persons. Kenya established a rescue center for vulnerable older persons. Nigeria introduced mechanisms to address elder abuse, and Malawi formally recognizes older persons in traditional leadership roles. These efforts show that what is possible when older persons are valued and supported through the right policies. Now, looking ahead, the fifth review and appraisal cycle is now underway as member states agree to the process during the 63rd session of the Commission for Social Development that was recently held this past February. National reviews are scheduled to take place next year in 2026, and regional reviews will follow in 2027. That same year in 2027, we will also be marking the 25th anniversary of the Second World Assembly on Aging. This milestone offers a powerful opportunity to renew global commitment to the Madrid Plan of Action. The cycle will culminate in 2028 with a global review to be held during the 66th session of the Commission for Social Development. This global review will take place on the third day of the session, and subject to the Commission's rules of procedure will include two formal meetings. First, a high-level panel on the outcomes of the fifth review and appraisal, and second, a multi-stakeholder interactive panel discussion with the executive secretaries of the regional commissions. These sessions are designed to bring together diverse perspectives, highlight regional progress, and support shared learning among member states and partners. In preparation for this, member states are encouraged to make full use of a bottom-up participatory approach, inviting civil society, including organizations of older persons, to contribute at national and regional levels. This includes submitting their views on the implementation of MIPA and on regional action plans. They're also encouraged to consider providing adequate assistance to enable civil society participation throughout the review process. This is essential to ensuring that diverse voices, perspectives, and lived experiences inform the path forward. Colleagues, the fourth review and appraisal gave us critical insight into the challenges that older persons face and the areas where progress is within reach. Africa's experience underscores the importance of inclusion, system strengthening, and sustained collaboration. As we move through the fifth review and appraisal process, let us continue working together to ensure older persons are seen, heard, and supported at every level in every region. The Stakeholder Group on Aging and this Africa Vanguard will be instrumental in shaping that future. Let's ensure that by the time we reach the global review in 2028, we can point not just to processes, but to lasting results. I thank you for your attention.
Thank you so much. We've heard it. We know that our gathering here this afternoon is very pivotal. So now we are moving on to the goodwill message. Okay, I need to, because this is a video recording. So it's a video recording because it's traveling across Africa and he didn't want any mishaps with this. Okay, now I need assistance because I need to turn this. Okay.
Do you have the link for the video, BC?
Yeah, let me send you that. Okay.
Is the link not on this presentation?
No, it sent a video. And when I open it, it's I need to turn it.
Okay, so you need to stop sharing. Start your video, stop sharing, and yeah. So now you find the screen that has the video.
Right? Can I send it to you? Maybe you'll be able to.
Okay, maybe we move on to the next agenda item and we can bring that back.
I've sent to you.
Okay, let me try and see what I can do.
Distinguished ladies and
okay. BC, do you want to move on to the next agenda item in the meantime, and we'll come back to this?
Okay. Okay, the next agenda item is Shola Mahoney from Gambia, Aging with a Smile. He'll be talking to us about update on status of regional and global instruments of human rights of older persons, operationalizing protocol.
Sorry, I think it's Ellen. Is it not Ellen?
No, it's not. It's not.
Remarks,
comes.
remarks, and then highlights.
So Shola, please, can you come on board? You are welcome. Please take the stage and.
Just to be sure, is it Ellen or MM that's next? I thought it was Ellen myself, based on my list.
On the program, normally the protocol is for the national government to come on board, but then I rearrange in order of the topics.
Okay, fair enough.
Yeah.
Let me start to share my screen. Can you confirm that you can see my screen and hear me okay?
Yes,
Yes, we can.
Very good. Look, thanks very much, colleagues, stakeholders, friends. What I have for you today is to provide some of the background, the context to this webinar, which is to kind of let everybody know where we are, give you a bit of an update on how things have been and how we stand. And at least from my point of view, and some of these views I've shared with others, and I've got input from others, is how we see things going forward. This is all about, protecting the rights of older persons, and I want to give you the update on these two really important documents, the AU Protocol and the UNHRC, the Intergovernmental Working Group. And I think without belaboring the point, I think we all realize that we are at something almost of an inflection point right now. Really important that what we try to do is to harness the momentum that has been generated on these particular these documents in particular. And because for a while now, it seems that we have, as far as aging in Africa is concerned, we haven't been able to get the traction or maybe get even the attention that we believe that we have deserved. As you know, if you go back as far as the Madrid Plan of Action, different regions, I think, have made quite a bit of progress for various reasons, although various countries in Africa have done well in different areas. I think, generally speaking, we've come to the conclusion that there's so much more that should be done and could be done. And the idea is that if we somehow pool our resources and our forces together, we should be able to move the ball significantly more forward. Let me move to the next slide, sorry. Are you still seeing? Right. Just by way of historical background, the AU Protocol on the Rights of Older Persons, adopted by the AU in 2016, that's almost 10 years ago, and its purpose, I think we all generally have a sense of what the purpose was and is to safeguard the rights and dignity of older persons in Africa, which is really very much what we are all about. And I've listed here a couple of the key provisions. Prohibition of age-based discrimination, protection against abuse, harmful practices, and the rights to healthcare and social protection. And if we look at the status right now, the numbers that I have, and I got a download from the AU, is that as of May 2025, 16 countries, and 15 are required for full implementation. 16 countries have actually fully ratified, which means not just going through the parliament, by the way, but also formally depositing the legal instruments with the AU. We are at the number of 16. And I make that point because Gambia is one of those countries that has taken the process as far as the National Assembly, but it is really so important to complete that particular part of the process, which is to go through Ministry of External Affairs, Justice, and Ministries of Justice and so forth, and have the document deposited right there at the AU. But generally speaking, what it means is that we have essentially fulfilled the basic requirements for full implementation. But I think the point also to make is that that is just, to some extent, I think when I was involved, you have the impression and the thought that, oh, well, once we've done that, we are more or less at the end. Well, no, you are at the end of the beginning. There's a very long road that we still need to travel. And this is what I think we're trying to do here, is to galvanize the attention, galvanize the energies of everybody who is part of this movement in Africa, so that we can move together and make sure that the rights of older persons in Africa are protected and indeed enhanced, and their well-being improved. At the same time, the UNHRC, that's the Human Rights Council Intergovernmental Working Group, there's been a significant development at that level because a resolution was adopted on the 3rd of April, backed by over 17 member states. And the mandate, even though it's just a working group, it is significant because the mandate is that it will go ahead and draft a new legally binding international convention on the rights of older persons, one that will address the gaps that we believe currently exist in the international human rights framework, where there is no specific mention of older persons. And so where there are other groups, vulnerable groups which are mentioned, older persons are not mentioned, and it's oh so easy, as we know from past experience, for those rights to be glossed over. And that's one of the key things we want to address. And so why is that particular development on the 3rd of April, why is that important? Because it does signify a commitment to elevate the rights of older individuals to the same level of international legal protection as the other groups. And we're talking about women, children, and so forth. And just to say that just bear in mind that this is now drafting a convention. There will still be a mountain to climb in terms of getting everybody to sign on and having that adopted at the international level. But it is still, nevertheless, a very significant first step. And so because I don't want to belabor the point, and just to kind of almost jump to not so much the conclusion, but the big question, so what? What next? Why is this so important? Well, I think it's important because both these initiatives provide, if we manage to, and I'm sure we will, to get them in place, they will provide comprehensive protection for older persons rights at the regional and at the global levels. And as we know, these are documents that will seek to combat ageism, ensure access to health and other care services, and basically promote the active participation of older persons in society. And so when I think of the next steps, what is it that we have to do? I think as a group, first of all, individually, countries like mine, and I'm with, are you hearing me, by the way? I'm getting
We can hear you.
Am I coming through?
No, we can hear
Fine,
you.
excellent.
Yes.
Just to say that here in the Gambia, I'm part of a small community-based organization that's focused very much on older persons, their rights and their well-being. But we have to step up. We have to step up and start pressurizing government in any way that we can to make sure that the several steps that are required from ratifying this document to getting it domesticated, because that is perhaps the next big milestone. Once we've deposited the instrument, then we've got to find a way of making sure that the system here builds on that momentum. We get Parliament involved and we get it domesticated. And I put that on the table because I have a feeling that that might also resonate with a number of different countries. Just to be aware that in order for us to have the kind of Africa we are looking forward to, and this is the kind of thing that's reflected in the AU's 2063 agenda document, in order to have that, it really is important that we put our shoulders to the wheel now. It's a long road ahead, but we really have to focus on getting past some of these bureaucratic hurdles. And we know that's a huge task. A lot of our organizations are very active in the field in terms of what they've been able to do with communities and so forth. But it's only when we get the legal backing, backed by acts of parliament, backed by laws and legislation, that we will really truly be in a strong enough position to guarantee and protect the rights of older persons. And so just to say that for me, as I think about where we are, the key point is that right now we must build on the momentum that we are generating and leverage this synergy that we have, the synergy that we feel around this call, the synergy that we feel when we see different pieces of news and achievements from our colleagues, whether it's Dr. in Nigeria or or we hear from Famada in South Africa. Those are things that we must use to propel ourselves forward. And because I see this as a movement across different African countries, not each one of us doing different things individually. And so I leave with this picture, the road ahead, just to say it is a long road. It is a road that going to have a few bumps, a few twists and turns. But I think the only way for us to get forward is to lock arms together as comrades, as it were, in this particular movement, and address step by step the challenges that some of which I've already outlined. I think I'm going to stop there just to say that we do have online here somebody who, under normal circumstances, would have been the person presenting here, which is Lefoko, who was our desk person, our expert at the OAU, at the AU. He will be available to answer questions, as will others. But I think just to get the ball rolling, this is what I wanted to present within the 5 minutes or so allotted to me. Back to you, madam.
Thank you so much, Mr. Shola Mahoney. While I'm not disregarding protocol, I would like to seek the indulgence of Dr. Omokaro. I had called on Mr. Mahoney because he was present at the African Union, and he attended the meeting to formally activate the protocol after 15 states had ratified and deposited the instrument. So we wanted to get that perspective from the African Union. I think I can go back to our goodwill messages now from Mr. Tony Ojukwu, who is Executive Secretary, National Human Rights Commission. Please.
Gentlemen,
yeah.
It is my honor and great privilege to be invited to deliver this goodwill message at this very important Vanguard webinar organized by Stakeholders Group on Aging Africa, with the theme refocusing and strategic positioning of SGA Africa for impact delivery for older persons in Africa, human rights and policy. The theme of this webinar has been carefully selected to serve as a wake-up call on the need to engage with critical stakeholders to develop measures in addressing challenges affecting older persons within the African region. Over the years, older persons have been relegated to the background.
Sorry.
English ladies and gentlemen.
I think I will cut this outright. Without further ado, let me call on.
But it's going on well now.
It's going okay because
please it's okay. It's okay. We are here.
Okay.
Distinguished ladies and gentlemen, it is my honor and great privilege to be invited to deliver this goodwill message at this very important Vanguard webinar organized by Stakeholders Group on Aging Africa, with the theme refocusing and strategic positioning of SGA Africa for impact delivery for older persons in Africa, human rights and policy. The theme of this webinar has been carefully selected to serve as a wake-up call on the need to engage with critical stakeholders to develop measures in addressing challenges affecting older persons within the African region. Over the years, older persons have been relegated to the background despite their immeasurable contributions to the family, community, country, and the world at large. Despite all their contributions, older persons are not being appreciated or valued as much as they should be. They are faced with different forms of human rights violations, ranging from physical and verbal abuse, neglect and abandonment, discrimination, stigmatization, non-inclusion in policies and development agendas, etc., etc. Some of these violations are due to the negative stereotypes society has placed on them. Today, the story must change. Society must not see older persons as a burden, but rather as a blessing. This calls for reaffirmation of our commitment to leaving no one behind in line with the Sustainable Development Goals. It has become very essential that we should work towards ensuring an age-friendly environment where the needs and rights of older persons will be adequately taken care of, such as access to health, regular income, equitable distribution of resources, basic services, care and support from the family, the state, the civil society, and private organizations. It is important to note that the rights of older persons are human rights, which are enshrined in the Universal Declaration of Human Rights, the African Charter on Human and People's Rights, the African Union's Agenda 2063, the Protocol to the African Charter on Human and People's Rights, on the rights of older persons in Africa. We dealt comprehensively with the needs and the rights of older persons in Africa. There is thus an urgent need for all African countries to sign and ratify this unique protocol. The National Human Rights Commission is delighted with the adoption of Resolution A/HRC/RES/58/13 by the Human Rights Council. We paved the way for the establishment of an open-ended intergovernmental working group with the mandate of submitting to the Human Rights Council a draft international legally binding instrument on the human rights of older persons to ensure the promotion, protection, and full enjoyment of their rights. Permit me to say.
Okay, I think it got there. All right. I'd like to call on our very delectable Director General for the National Senior Citizen Center of Nigeria, Dr. Omokaro, who will also now be, going down to the nitty-gritty of one of the reasons why we are here. We know that for the Africa we want, for us to get that Africa that we want, to achieve that African agenda, we must ensure that no one is left behind, especially the voices of our older persons. Dr. Mokaro, over to you. Thank you so much for joining us and being a part of this process. The floor is yours.
Yeah, I'm preparing to share my screen now. Yeah. Is everybody seeing the screen?
Yes, we can see the screen.
Okay.
If you want to do that,
firstly,
increase the size at the bottom on the right.
if you take that little button on the extreme right, so that it focuses on each slide one by one. The single camera.
Okay.
Okay, are we good now?
Mm-hmm.
Okay, so firstly, let me thank everybody for showing up. I thank Bessie for coordinating. And I want to firstly do a disclosure that yes, member state representing Nigeria as the Director General of the National Senior Citizen Center, at the same time with very deep interest in the workings of the Stakeholder Group on Aging Africa. That is because from my experience and Nigeria's experience, you would know that it is the momentum from bottom up, the momentum from civil society organizations, non-governmental organizations, expert groups, all that critical mass of stakeholders that really moves the needle for government. From Nigeria's experience, I know that the legislation that established the National Senior Citizen Center, the policy document, and all the strategic roadmap that we have really were inputs, really came from bottom up. So with that interest and also with the passion to see Africa really, walk the talk with improving the quality of life of older persons. That is why I'm here, wearing both hats as somebody who is deeply invested in Stakeholder Group on Aging Africa and also as a member state. And so, yes, my topic is to talk about the coalition, how we build the regional coalition for a united and coordinated perspective on older persons' rights and policy inclusion for effective advocacy and engagement. So how do we position Stakeholder Group on Aging Africa? I want to thank my brother Shola for really, giving us those, critical outlines and then pointing us to the road ahead. And that road ahead, it cannot be one member state. It has to be the collective, all member states. And it has to be through the instrumentality of the inclusion, inputs and the push, elder justice advocacy from, SGA Africa. So just permit me to say a little about SGA Africa, not as a member state, but as somebody who was a co-convener. That this is actually a coalition of civil society organizations, including Association of Older Persons organizations, representing older persons. We have professional bodies amongst us, non-governmental organizations in multi-sectoral field of aging. We have human rights institutions, like you heard Executive Secretary, Nigerian Human Rights Commission, very much involved in Stakeholder Group on Aging Africa. We have researchers amongst us, academia, private sector, and individuals with interest in elder justice advocacy. As at 2020, we had over 130 organizations, as members. That's as organizations, not as absolute numbers. In absolute numbers, we had nearly 300 and something, 400 persons. And so the aim of SGA Africa is actually to coordinate the older people's constituency group in the African region and to constructively engage and promote understanding and inclusion of older persons in SDGs platform, in SDGs, AU Agenda 2023, and also, as Shola did say, advocacy, high-level advocacy for ratification and now operationalization of the protocol to the EU Charter on Human People's Rights and Rights of Older Persons, and also to engage very seriously in the process of the drafting of an international binding instrument to promote the rights of older persons. I want to quickly move to say that SGA Africa actually is an engagement mechanism of the African region of. And what that says to us is that SGA Africa, just like other major groups and other stakeholder groups, like you have the women group, you have the youth group, you have the indigenous peoples group, it was created as an engagement mechanism. Engaging with who? Engaging with member states. So that platform where you have member states going for, peer review over performance in SDGs, you have civil society organizations, you have stakeholders group, different groups, and you have major groups going there to engage member states and to point out the gaps and to really engage in high-level advocacy to ensure the inclusion of older persons. And so that shows you that, look, this is not a group to toy with. This is a group that has a mandate, and that mandate is to collect every information that is necessary to ensure that the member states are informed and the member states really are pushed, that push in inverted commas, to really know that, to hear the voice of older persons. So we have the African Regional Forum. We also have the high-level political forum. The high-level political forum, this is a United Nations level engagement where member states now from different regions carry their articulated key messages from the regional forum to the United Nations forum, to be able to have that collective global solutions on things. So where the voices of older persons are missing from the grassroots, from the regional forum, then how can their voices now be heard at the high-level political forum? So that really shows, the import of mobilizing, sensitizing, and repositioning SGA Africa to really magnify the voices of older persons, on these issues. Now, I want to also go further to say that SGA Africa also was very active at the UN Open-Ended Working Group. We had side events, made statements, speaking on behalf of the African older person. And most of the times, a lot of the times, we got our messages, even also reflected in the statement of the UN Secretary General. So just to give us a sense of what this group can continue to achieve, I just want to outline a little bit of what this group, achieved in time past. SGA Africa, hosted the very first African regional, conference on aging. That is where, we really mobilized ourselves. We saw ourselves coming from different countries, and we gathered in Abuja, Nigeria. And we're able to set up that steering group. SGA Africa provides the platform, and so we're hosting webinars, collective learning, sharing information across the region, articulated current and global issues. We just saw UNDESA present to us, highlights of the fourth report, on review and appraisal of MIBA. SGA Africa would have carried that report, and then really stripped it down so that we know, what country is doing what and where we really need to mobilize and the gaps that we needed to fill. So that is why SGA Africa is very important to us. SGA Africa was able to attend, African Regional Forum, UN, high-level forum with key messages, and then we'll come back with the key messages, and then these key messages will be shared across the country, and that will now inform, in country, elder justice advocacy. And SGA Africa was also involved in research. I remember we undertook a research on impact of COVID, and that research was published by the UN International Institute on Aging. They have a journal for aging in developing countries. And because of the force of SGA Africa, that the editors had to give us a special focus on Africa, where we had members of SGA Africa really, publishing papers. Remember, we had papers from Uganda, from Zimbabwe, from Nigeria, so we had a window there. And also, SGA Africa, had strong relationship with AU, UNDESA, and UNECA in all the things we did, showing that we really penetrated, top government agencies, and we're able to get the voices of older persons. And at some point, we really had, AUC, through Lefoko, my brother is in this meeting, telling us that, yes, become like their technical advisors, when it came to issues of policy, issues of data statistics, and so on. And then, of course, that they have, and of course, we all know that AUC, they have the veto power to summon, ministers of social development. And they could work with us, and then we could use these platforms to really magnify the voices of older persons. I said this to say that what we have is gold. The platform that we have is so precious because it's a collective voice. It's a collaborative voice. It's a voice that will harness the data, the resources that we have, our passions, our energies, our expertise, and then bring it to the table, whatever that forum is. And now we have moved, as we have been told, now to the Human Rights Council. And that is where negotiations, we cannot talk about drafting without serious negotiations and positioning to have the voices of, with the context of the region, the context of culture, and to have it heard. And so we have also been told about the coming MIPA review. that is starting bottom up, like we know, is member state led, but within every country, you have stakeholders engagement, you have NGOs, CSOs coming together, to look at the gaps, to really appraise the country. So what will be the role of SGA Africa? How do we make our members in the different countries understand what MIPA really is and understand the import of policy, the stake of policy? That is why SGA Africa cannot sleep. Truly, SGA Africa cannot sleep. And so my question is now, so do we have a plan? We know that for the past 4 years, SGA Africa was not heard anywhere. For the past 4 years, we've had platforms that what we post is we're just posting. There is no correlation of the posting for information. It's not coordinated information to unite our perspective, to even set out what our perspective is, And so do we have regional reports and sub-regional reports? So who speaks for African older persons at the Stakeholder Group at the African Regional Forum when they are talking about sustainable development goals? Who is speaking for African older persons at the UN High-Level Political Forum? Speak and bring in the content, the community grassroots content, the real older person that is suffering, the neglect, the marginalization, the gap, like we heard UNDSA told us in social services, health services. I'm going to point all that out. Who's speaking for them? So where do we get the reports so that we can analyze and comparatively see where Africa is? And then who is going to engage the member states? Who will engage the member states? How can Nigeria have a comparative analysis of what is going on in other countries, really? If we cannot have an SGA Africa report, comparative report that can now advise, member states. We have the African group, and Nigeria also work very like Gambia and all that. We know what it is, the diplomacy that happens at this high level. So if you don't come as a group, with your value to negotiate, you'll be left behind. So that is why we thought it was very necessary, like we call it SGA Africa Vanguard. We're over the voices of older persons. And so when I say what next? I just have questions and some suggestions. I say again, from looking out as a member state, what I would love to have as for the Director General of National Senior Citizen Center, if I'm called upon, like I've been, very frequently called upon. And when they're asking you to speak, they're not asking you to speak for Nigeria. They're saying speak for Africa. And what justifies me to speak for Africa when I do not have, collective inputs? And so first, we must define a clear objective. What do we want to change in Africa? Or at least influence about matters concerning older persons. And how does that resonate across Africa? Do we have variables? So do we have a plan of action? Can we define the platforms and the things worth fighting for within each platform? So for instance, African Sustainable Development Goals. So when we go there as a stakeholder group, that thematic area that is presented, normally is yearly, there's a theme. What should be our key message? So we need each other. We need our passions, our knowledge, our expertise, so that we can go as a collective group and engage the member states there for the sake of older persons. We must gather evidence for the unique African context to support informed advocacy. That's why SGA Africa used to do, surveys, to come up with, some statistics to help. And then we used to ask, different countries to share their statistics, and then we must come up with a strategy of communication. So how do we write compelling messages? Where do we meet to gather these compelling messages? How often should we meet? How are older persons contributing to the key messages? That's why I want to really appreciate our members in SGA Africa working in communities. I know what is happening in Kenya, in Malawi, in Gambia. I know what is happening in Ghana, all of us, South Africa, even up to the Congo. Look what is happening in Sierra Leone. We have critical stakeholders, people that are in the grassroots, in the trenches, working. But how do we come together and harness all this information that we have and build strong partnerships, really strong partnerships that going forward now, SGA Africa, on behalf of all the persons. Going forward now, SGA Africa, will have strong partnership with UNDRESA, with UNECA, African Commission, with member states. We take up, that partnership with AUC that will cause them, to compel a meeting of, ministers of social development and have SGA Africa have an opportunity to contribute. And so I just had a few recommendations before I close. I hope I've not overshot my 5 minutes. So we must facilitate the restoration of this waning interest of stakeholders. We just must do it. We must inspire effective leadership to accelerate advocacy actions. How that is done has to be your collective consensus, collective decision. Nigeria is not going to be part of that, but it is needful that you have inspiring and effective leadership. And we must identify strong aging rights policy program influencers working as non-governmental organizations, working in the field of equity development corridors, in those corridors, who are strong local and visible regional network support actors. I know I see all of you here, and this is what you're doing. So these are the kinds of people we need, people that are engaging directly with older people, people that are engaging, and can bring out exactly what is going on in the grassroots. We really do not need people, that are working in, the public sector and hardly see other people, hardly are in the grassroots to lead SGA Africa. It's not going to work. So it has to be people that are in these equity development advocacy corridors. Those are the people that should lead SGA Africa. Persons who are known to be committed, selfless, and I say it with every sense of responsibility. This work needs selflessness and a passion that must drive you and take your sleep from your eyes, if we must make any, headway. And we need to facilitate and invigorate the partnership. I already said that with all these agencies, because they need us and we need them. And then also research survey publications must kick off again. It helped us. So we must commence the generation of, evidence, because member states need the evidence. I know what it took me to convince Nigeria's permanent mission to be part of the bureau of the UN Open-Ended Working Group on Age. I kept bombarding them with evidence. At some point, they say, look, we are too busy to be part of this. If we join, you will do the work. I say, yes. If there's any work, I will do it and send it to you. So it takes a lot of commitment to get your member states, to really sit up and work. And so finally, I want to also thank the Executive Secretary, Nigerian Human Rights Commission. Through him and through others, we must reactivate that partnership with the Network of African Institute of Human Rights. And then thank God, I'm happy that Ellen is here. Ellen has been the coordinator of the GAROP Secretariat. She has done fantastic, unqualified work in advocacy and driving all the members for a consensus. So Ellen, we need that partnership with GAROP. SGA Africa needs that partnership with GAROP, the capacity building and so on and so forth. So together we can be, positioned to speak for African older persons as much as we speak for the global, rights of. On that note, I want to thank you very much for giving me this opportunity and bearing with me. Thank you so much.
Thank you so very much, Dr. Omokaro, for that wake-up call and for that very well-packed, you came up with what next and the recommendations that you are urging us to follow. We commend you with that, and we hope that by the end of the seminar this afternoon, we would come up with concrete action plan. Thank you so much. I would go to Miss Ellen Graham. She's the CEO of Global Alliance for the Rights of Older People, GAROP. Emma spoke a few words about her involvement and engagement and all the good work they've been doing at GAROP. Helen, thank you so much for joining us this afternoon. And over to you.
Thank you. Thank you so much. And I'm very happy to hear. I think I've had a promotion because I'm a coordinator rather than a CEO, but I thank you very much for the introduction. That's fine. Thank you so much, BC. Thank you to the organizers for inviting me to this webinar today. I'm really honored to be here, and I bring warmest greetings from GAROP to all of the colleagues present. It's really exciting to be speaking on this topic at this moment in time as we celebrate a significant milestone, the adoption of Human Rights Council Resolution 58/13 just a few weeks ago. This resolution, as you have heard, establishes a new intergovernmental working group tasked specifically with drafting a legally binding international instrument, a UN Convention on the Human Rights of Older Persons. This historic achievement was made possible through the determined efforts of a core group of member states working together in Geneva: Argentina, Brazil, the Gambia, the Philippines, and Slovenia. The resolution was adopted by consensus and with strong cross-regional support from many states. And it also represents the culmination of many years of determined advocacy by civil society, older people, and dedicated campaigners and advocates around the world, including many in the African region. So congratulations to all of you who were involved in any way. Some of you are here today, I know, and some colleagues, sadly, are no longer with us, but we honour their legacy, and their activism continues to inspire us as we move forward. The negotiations on this Human Rights Council resolution came just a few months following the coming into force of the African Union Protocol on the Human Rights of Older Persons. There was a lot of positive engagement and clear support from member states in the African region in the negotiations on the draft resolution in Geneva. And there's no doubt that the hard work and year-round advocacy of GAROP members and other NGOs and stakeholders, such as national human rights institutions in the African region, contributed to that development. I spent 2 months at the UN in Geneva in the run-up to and throughout the 58th Human Rights Council session, working with members from our network to connect with their government's permanent missions in Geneva. And this helped us together to build support more immediately for the resolution, but also to build and strengthen relationships that will continue to be valuable to us as we move forward with a drafting process. So your advocacy as NGOs and stakeholders at the national level is recognised by governments in Geneva, and it did play an important part in securing the resolution. I'll just say a few words about our Global Alliance and its journey. GAROP was established in 2011 in response to a growing recognition of the need to strengthen the rights and voices of older people at the international level. At that time, the United Nations had just created the open-ended working group on aging following a 2010 General Assembly resolution. And since then, GAROP has grown into a powerful coalition of over 400 diverse NGOs worldwide, with our largest regional membership base in the African region. So members in Africa make up 40% of our total global NGO membership. We recognise the value of our members and other NGOs organising and working with other stakeholders at the regional level. Firstly, this can enhance our collective impact by generating valuable learning and insights from regional level work on older persons' rights, including the process of developing and implementing the AU protocol, for example, something I understand many SGA Africa members contributed to. Secondly, coordinated regional advocacy enables civil society to engage effectively with regional institutions to raise awareness at that level and strengthen regional positions, which could also be important as we move into a drafting and negotiation phase. And thirdly, regional networks provide an important complement and bridge between national level campaigning and our global level coordination. It can create space for networking and the sharing of experience and information across NGOs and stakeholders in the region. And because governments organise and coordinate in regional groups in Geneva, it helps if we can too. Historically, GARP has always been delighted to collaborate with the SGA Africa in support of its important work to strengthen the promotion and protection of the rights of older persons in Africa, and we welcome further cooperation in support of this shared goal. GARP has always worked closely with the NGO Committees on Aging in New York, coordinating civil society participation in the open-ended working group on aging, where we also worked closely with UNDESA and collaborated with the Global Alliance of National Human Rights Institutions too, an important partnership for us and our members. And increasingly now we are working with the NGO Committee on Aging in Geneva at the Human Rights Council, as well as the Office of the High Commissioner for Human Rights. Going forward, we will be working with the NGO Committee on Aging Geneva to organise and mobilise civil society participation in future Human Rights Council sessions and to advocate for an inclusive and transparent drafting process for a convention. We recently developed a joint document with the NGO Committee on Aging Geneva explaining how we propose to approach this together with our unique partnership, and I'll post some links in the chat in a moment. Older persons across Africa must be meaningfully and fully involved in this drafting process from the outset. NGOs and networks like the SGA Africa can play a vital role in supporting this, helping to raise awareness and mobilise action and consultations across the region and bring the voices and lived experiences of older persons firstly into GARP's own work to develop proposed content from civil society for a new convention, as well as directly into the UN discussions and negotiations. So I'd like to finish by applauding the organisers of today's timely discussion, and I look forward to further work together in this new exciting phase of advocacy around the drafting of a new UN Convention on the human rights of older persons. Thank you for your attention.
Thank you so much, Ellen, for that wonderful presentation and for reminding us of all the things we need to do to strengthen the voices of older persons at the international level and including in drafting of new UN conventions. Before we move on, I just quickly glimpsed the chat and I see one or two questions. And I would like to open the floor for, for 5 minutes for comments and questions before we move on. One of the recurring questions actually is about how to join SGA Africa. Please drop us an email and the forms will be sent to you. Who knows, maybe Carol can also drop the form in the chat so that people can take over from that. Any questions from the floor? I saw one very interesting one from Arun Ngeri. Arun, are you able to ask your question?
Thank you. You can hear my voice?
Yes, we can hear you.
I'm located somewhere in Kenya, Vika. My concern is about religious interventions when it comes to the older persons. I have followed the speakers so far. I'm a clergy, and I'm also a retirement consultant. I'd like to hear more because when people retire, even in the corporate, they end up being our members, and they have been also our members during their active time. And that's their fallback, the religion that is in the churches and also in the mosque and all this. I would like to hear more how the SGA is incorporating religious interventions for the older persons. That's my concern.
Thank you so much, Aaron, for that question. Is it directed at anyone in particular or any member of our panel? And
I think Dr. Amukola can try to respond to that. I have followed her presentation.
Yes.
The research has been done here and there. Where are you incorporating the religious?
Yes, as the name says, Stakeholder Group on Aging Africa. And when I talked about the composition of that group, I mentioned that it's civil society organizations. I mentioned there's non-governmental organizations, anybody in the field of aging, associations representing older persons. And I went on and on and on, research academia and all that. And these associations, some of them are faith-based. I give you an example. In country, in Nigeria, we have the Stakeholder Consultative Forum on Aging. And the Stakeholder Consultative Forum on Aging is a consultative forum that has been established across the 36 states and the Federal Capital Territory. In Nigeria, we have 36 states. And the composition of that Stakeholder Consultative Forum on Aging is of 8 major categories of stakeholders. And one of the major categories is faith-based organizations. That's where you have, the churches come in there in their association and fellowships. You have the mosque, Islamic religion. We also have elders council, representative of, traditional institutions, as much as also we have, civil society organization, community-based organization, not only in aging, but aging, gender, whether you're in nutrition, human rights, disability, and so on and so forth. So I think first and foremost, if you're talking about the regional grouping, SGA Africa has a room for all associations speaking and representing older persons and older persons themselves, even if it's a church organization. So long as you organize, you are an organization and you are interested in elder justice advocacy, you're welcomed as an association into SGA Africa. And then within the country, that would be in-country context. I just told you the Nigerian context. So the churches are very much part of what we are doing. In fact, even the cooperatives that we are forming for older persons, the churches also are forming, we are working with the churches also, and the mosque to form senior-led cooperatives. I hope I've been able to answer your question to some extent.
Yeah,
It's clear, Doctor, and I'll seek to know where the SGA is in Kenya to join my other fellow panelists who are here and hear our concerns. Thank you.
Okay, all right. Thank you.
I also see Mr. Mahoney's hand raised.
Yes, just a very quick one. Thank you very much, Madam Chair. And maybe this is one for Dr. M.M. Omokaro. I was wondering, this is a wonderful group, and frankly, I'm a great believer in how effective informal groups can be. But do we have an official status of any sort, any accreditation, or are we basically a group of people who have a group of organizations, rather, and representatives thereof who have come together because we are essentially part of a particular network? I'm curious to know, because it just occurs to me that the AU Commission is based right here in Banjul, and I really feel as if I've been shirking my responsibilities and not doing enough, and I wonder whether there's something I can do to be a little more useful, or to be maybe just a little more useful.
Trust you, my brother, you're going to do a lot right now, not for now. So now, I said earlier that the legitimacy for the founding of SGA Africa actually is as an engagement mechanism, of the, African Regional Forum on Sustainable Development Goals. Sustainable Development Goals, the African Regional Forum is a platform where member states from all the countries in Africa go there to discuss, implementations and, evaluation of country level performance and so on and so forth on SGA Africa. And that is where you have them now form civil society organizations. They call it, you have the major group. Actually, it is called major group and other stakeholders. The major group, you have the women group, you have the youth group representing children, even the researchers are there, indigenous, every group, so that nobody is left behind. And then when you have other stakeholders, now you have aging, then you have persons living with disability, and so on and so forth. So our first takeoff was as a regional engagement mechanism on the African Regional Forum. And from there, you extend it to the high-level political forum. Because the key message is that all the CSOs and all the persons come together, to reach a consensus. That is the key African regional key message that is taken to the high-level political forum. However, because issues of older persons were issues that were totally marginalized across all platforms. That is why when we now convened SGA Africa and we came together for the first African Regional Forum, we said, no, we cannot afford to limit ourselves as the engagement mechanism only at the African Regional Forum and wait to go there once a year. And we cannot also afford to limit ourselves as engagement mechanism, extending from the African Regional Forum to the high-level political forum, and then confine ourselves to only issues of policy and development, which is the SDGs. Whereas UN Open-Ended Working Group on Aging, they are discussing the rights of older persons to a convention. And so that is why we pushed and moved, and our voices began to be heard at the UN Open-Ended Working Group on Aging. SGA Africa, because it was not a registered this thing and didn't have a consultative forum at that level, used to come through the Devo Mokaro Foundation, as you know. Used to speak through the Devo Mokaro Foundation. And so we got our messages all the same head. And then our research, we decided also to engage in research. How do we gather data? So it was the need of African older persons, the gaps and the marginalization that we had seen, that we now taxed ourselves. No, we can't afford to box ourselves into one place. It has to be about policy and rights. And so you asked about the legitimacy, that is where. But would you want to go further to now register it? That's another thing. Because I know that at the African Regional Forum, it's an engagement, it's a mechanism. It's a mechanism. It's a collective stakeholder group mechanism to speak on behalf of older persons. So I hope I've been able to.
Understood. Thank you. Thank you, Madam Chair. That's fine. Thank you. Excellent.
Yes. So we move on because we are now trying to raise up to catch up with time. We still have a few speakers to come on board. Thank you so much, Dr. Mokaro, and thank you, Shola, for that very pungent question. I think the foremost thing is to get SGA also registered and get the consultative status with the UN. I'll now like to call on Ms. Moira Allen. She's the CEO of Pass It On Network, and she'll be speaking to us on magnifying voices for Africa's older persons in human rights and policy development process, the role of SGA Africa. Moira, over to you.
Sorry. Thank you very much. I'm so excited to be here amongst you all. We've got such an enormous task to do, and the only way to get it done, as Ellen has said and as Dr. Mokaro has said, is working together, standing together. So I would just like to give you two fundamentals that have influenced our network. The Pass It On Network, which is a civil society that connects positive aging advocates from around the world so that we can share our strengths to help each other, our families, our communities, and ourselves. We're present in 65 countries with a growing number in Africa and especially in Southern Africa. And I might just mention that if you ask me where home is, it's South Africa, although I do live at present in France. And then I'm going to just tell you a little bit about the background of Pass It On Network, because I think it's very pertinent here. We're seeking to say how we're going to have impact and how we're going to relay the voices of older people. So I think this is relevant. Our network grew out of a meeting in 2007 between myself and Dr. Jan Hively. We were both attending the first ever Positive Aging Conference in the United States. And Jan was running a workshop which had as the title, Meaningful Work, Paid or Unpaid Through the Last Breath. We exchanged cards, struck up a friendship, and eventually landed up forming our network. Jan introduced me to a poem, and this poem has guided our network throughout. It's a poem written by an American Indian, the Chief Dan Evenhammer, who passed away just at the turn of the century when he was already 108 years old. Now, I'm not going to read the whole poem to you because we're short of time, but I just want to pick out some points. He said in this poem, "You've been telling the people that this is the 11th hour, and I'm telling you to go and tell them that this is the hour. And this is the time to speak your truth." He went on to say, "This could be a very good time. There is a river that is flowing now very fast. It is so great and swift that there are those who will be afraid. They will try to hold on to the shore, and they will feel that they are being torn apart and will suffer greatly. Know that this river has its destinations. The elders say we must let go of the shore and push off into the middle and be aware of who is around us. At this time in history, we are to take nothing personally, least of all ourselves. For when we do, our spiritual growth and journey comes to a halt. The time of the lone wolf is over. Gather yourselves, banish the word struggle from your attitude and your vocabulary. All that we do now must be done in a sacred manner and in celebration. We are the ones we have been waiting for." And that really struck me. For me, that last line, "we are the ones we've been waiting for," was the thing that really literally changed my life for me. I'll post the whole poem in the chat in case you want to see it. It is a revelation, that line, because up until, when you get to about 60, 65, you step into a space that's a bit different from all the spaces that you had before, because before we've always had somebody above us, a boss or a teacher or something, to tell us what to do. But when you step into that zone, you have to decide for yourself. And then the other thing that has really, my flipping computer printed things back to front, so I'm now lost. I'll find myself, sorry. Page 4, right. The other thing that I found very staggering was when I came across and realized for the first time the real true size of Africa. We're so used to seeing it spread out on a flat wall map with Africa in the middle and the Americas there and Europe up at the top, that we don't really have a good perception of the real size of Africa. And in fact, Africa, which is 30 million square kilometers, is so big. It's the second biggest continent in the whole world. And our perception of it is not commensurate with its actual size. You can fit in the entire land masses of the United States, China, India, Japan, and most of Europe within its borders. So let me just try to share and show you very quickly. No, it's disappeared. Sorry, I can't find the... Stop sharing. I'll put it into the post. But let me just say this to you once again. Africa is so great that you can fit in the United States, China, India, Japan, and most of Europe within its borders. And I think this is terribly significant. The 2 points. The one is the realization that we are the ones that have to step up. And the second one, to take full note of our size and the impact that we should have. As I see it, the road ahead for the SGA Africa is to step into our full role and play it from the strength of knowing that we are the ones that we have been waiting for. In other words, to take our future responsibility for us and to advocate for the full recognition of our rights and insist on the centuries-old cry of nothing for us without us. We have the opportunity now to play this role in the drafting of a United Nations Convention for the Rights of Older People. And that's where we have to step up. Now is the time. The time is to get in there, roll up our sleeves. I heard this absolutely brilliant, I think, quote the other day when at our 50-50 meeting we had Dr. Rick Moody talking about the eco-elder, and his subject, of course, was climate change. And he said that very often people are without hope. But he said there's this wonderful quote, and it says that hope is a verb that rolls up its sleeves and gets down to it. So I think this is what we all need to do, is to hope and believe. And why I also think it's so important just to emphasize the fact that we are the ones that we have been waiting for is the fact that if we want to get anywhere and if we want to have impact, we need absolutely to send out clear messages that every one of us can appropriate and repeat. Repeat when we're having a cup of coffee, repeat when we're meeting our friends, repeat when we're in meetings. It's by these little picks and continual reminders that we gain to advance. And every one of us has that responsibility. There's no point in saying that we're going to leave this to the SGA. The SGA is us. And we're the ones that have to step up and take act. Thank you.
Thank you so much, Moira. And then we move on to our last speaker, Femanda Sherman. Thank you, Femanda. She's been very helpful and instrumental in also putting this webinar together. She's the CEO of the Association for the Aged, TAFTA, and she'll be speaking to us this afternoon on healthy aging and well-being for Africa's older population. Femanda, over to you. Thank you so much. I hope she's still here.
Thank you, BC. Yeah, I'm still here. Thank you so much, BC. Good afternoon, everyone. I'm just, let me fight with my computer so I can get my screen up. If you could just share, can you confirm that you can see the screen with the elders in the corner with the South African flag?
Yes.
Perfect. Okay. All right. So thank you so much. I'm honored to be speaking at this webinar on the strategic positioning of SGA for impactful delivery for older persons. In particular, I want to speak about healthy and active aging. So I'm just going to not repeat some of the brilliant information that's been shared already, but just focusing on in terms of healthy aging in Africa. Let's start off. I had a wonderful supervisor who always said to me, start off by defining what you mean. So healthy aging, I'm going to take from the WHO, World Health Organization, is about a process of developing and maintaining the functional ability that enables well-being into old age. And that's so important. It's about functional ability, and it is about well-being as people get older. So when we start thinking about functional ability, it's about people's ability to meet their basic needs, to stay mobile, to build relationships, and continue to contribute to society. And that's so important because very often people assume that good health is merely the absence of physical illnesses, but good health is more than that. It is about being able to contribute, being able to be engaged, and being connected to the rest of the world. And I thought perhaps today I'll just focus on some of the frameworks that's contributing to our conversation around healthy and active aging. So we spoke about MIPA, the Madrid International Plan of Action on Aging. So that is a policy that's telling us these are the strategic pillars that we need to be delivering on. And that was operationalized with the Decade of Healthy Aging. So the decade is from we are in the decade at the moment, so 2021 to 2030, and we're sort of midway through now. The Decade of Healthy Aging has a number of different key areas that it's looking at. And perhaps let me start off with the 4 functional areas. It's around combating ageism, fostering age-friendly communities, delivering integrated care, and to look at providing long-term care. I'm probably preaching to the converted. Everyone probably knows all of these policy documents like the back of their hand. But it's, I think, just to take up from what Moira is saying, repeating helps. And it helps us to be able to contextualize how all these different pieces come together in terms of the puzzle of healthy aging within our continent. So when I was preparing for this, I was looking at the baseline report that they did for the Decade of Healthy Aging. And this baseline report, I like numbers sometimes. It just helps me put things into perspective. But this was quite interesting. 142 million older people are unable to meet their basic needs. So if ever we want to understand how great the need is, 142 million older people. And so, you can become burdened by this number, or you can become inspired to say, I have to do my bit, so that we can make things better for older people. Optimizing functional ability is the key to healthy aging. So we have to look at ways in which we can optimize their functional ability. This part is where SGA Africa can also play, because lobbying and advocacy is a non-negotiable. So we have to look at ways in which we can encourage governments and other stakeholders to invest in data and to monitor healthy aging across the life course. And I'm not going to go through each one of this because I'm just a bit mindful of time. In terms of the other policy instrument, I think that's so important for Africa, is the Commonwealth Roadmap to Healthy Aging. So the Commonwealth of countries made up of 56 countries. And possibly what people don't know is that the Commonwealth represents 1/3 of the world's population. So more than 2 billion people live within Commonwealth countries. And majority of the Commonwealth countries are in Africa. So 21 countries of the entire Commonwealth are in Africa. Last year in September, the Aging Well, the roadmap was introduced at CHOGM. And it recommends 5 main objectives. So it's recommending all people from Commonwealth countries, and I think it should be across the world, to look at some of these objectives, ensuring enabling and supportive environments. These words are very aligned to MIPA. That's one of the priority directions. Advancing health and well-being, again, one of the priority directions. But I think what's important is that they are adopting a life course approach. So it's not just about a medical model and looking at older people separate from the rest of the society, but really approaching it from a life course perspective, providing lifelong learning, employment, and volunteering opportunities. So, Moira, when I heard you speak about your first meeting with Jan and the whole thing about being meaningfully engaged, right until the last breath, the whole thing about lifelong learning and earning is essential as well in terms of good health, promoting age-friendly culture, and the issue around collecting better data, research and monitoring progress is critical. And this is one of the things that SGA Africa needs to be thinking about, because we cannot advocate and lobby for services unless we can measure what is happening on the ground. So being able to collect data becomes essential. Investing in research is a non-negotiable, but we also need to be able to monitor our progress and have robust monitoring systems, not the sort of previous linear monitoring systems. So we need to look at ways in which we can change the way we monitor and evaluate our systems. And then moving on, sorry. I think there's been so much of talk around the AU protocol, and I really am so proud to be of Africa, where the protocol has already been adopted. But when we're looking at health in particular, Article 15 talks about the right to health. Article 9 talks about the protection from abuse. 7 and 12 also talks about security, care, and support. All of these instruments are important because the framework already exists for healthy aging. So we've got all of these things that we can draw in and we can use in terms of our lobbying and advocacy. But SGA Africa has to strengthen and become the voice of older people, because it's no point in having all of these policy instruments, these action plans, if we are not able to harness and pull in the same direction. And Africa is strong. I think when we were looking at the planning for this kind of webinar, we said it's important for everyone who leaves this webinar to leave here with the sense that Africa is rising. I am part of something bigger and my voice will be heard. So my input today is really about looking at aspects around healthy aging, looking at how we position SGA Africa, but also looking at the initiatives that already exist in almost every country. There are examples, profound examples of healthy and active aging. And I had to put in this little picture of our go-go's in South Africa, the soccer go-go's. So they play soccer and they are so proud of what they do. And I know that in different countries, this is happening as well. In Kenya, there's examples of that. In Nigeria, there's lots of examples of this. So there's throughout our continent, there are inspiring examples of how older people themselves have adopted the attitude of healthy and active aging. But we need to tell the story, and we need to tell that story because these are the things that's going to be fed into the UN Convention on the Rights of Older Persons. So when we think about the future that we are passing along to the next generation, we must be rest assured that what we have done is laid the foundation for future generations to live well and to live healthy and active lives. Okay, that's my input. Thank you so much for your time and attention. Over to you, BC.
Yes, thank you so much, Fernanda. And I like the way you've ended. How can we position Africa? How can we share all these experiences from Africa? How can we share the data? How can we share all these and take them globally to the, for input into the UN Convention? We've come almost to the end, practically to the end of our webinar this afternoon. Before we go, I'd like to call on Essie, Dr. Essie Ansah, to help us, summarize all that we've been discussing today. Okay, there's a comment.
Can you hear me?
Yes, we can hear you. Do you want to share screen, Essie, or Fernanda? I think you need to.
No.
Yeah, okay. All right. Thank you so much.
Okay, wonderful. So thank you everyone for all the submissions that have been made. It's been really interesting listening to all the conversations, and it's good to know that we're all aligned. And a few things that, I noted as we were going through, we started with a conversation at the UN level, looking at the need for advocacy that is beyond every country. So in our conversations, there's work we need to do at our country level. There's work we need to do at the continental level. And then beyond the continent of Africa, making sure that we're demonstrating thought leadership. One of the things that struck me in the first presentation on the gaps in the social protection was really the lack of data. The lack of data. And I know it came up in another presentation, I think when Dr. MM spoke, research, surveys, gathering information, because ultimately the work that is being done across the continent will require data. We can't just arbitrarily make decisions about, policies, etc. So the role of data is something that I hope we can walk away with and begin in our own advocacy, in our own work, to start looking for ways to partner up, perhaps with some academic institutions, etc., to generate data that informs policy making. And then the conversation on the AU protocol, the rights of older persons, a continent of 54 countries and 16 who've signed on. There's a lot of work for us to do. A lot of work for us to do. And I looked through the list and I was like, oh, my people, I looked at my own country and we're not there yet. We've had a few conversations. So it's a rallying call to all of us so that in our various roles, in our various organizations, to actually work together as members of SGA to raise the awareness and at the country level begin to put pressure where pressure is needed so that the various countries can ratify the AU protocol as a starting point so that we can, in the words of one of our presenters, we can ride the momentum, leverage the momentum and keep going. And just listening to practical ways in which we can, as a group, engage from other presentations, including Dr. Emmons, looking at UN side events, AU events, there's research, there's the awareness creation, and there's the leadership. The space needs leadership. So it's a gap that SGA fills. The leadership that is needed to raise the awareness and, open the conversations up. And actions through partnership is one of the things that comes out strongly. And ultimately, from all the various pieces, the last two presentations, looking at actually what are some of the specific gaps where you have healthcare, where you have infrastructure, etc. One of the things we should also, all our conversations should bring our minds to is one, data and financing. For many of us, I'm sure when in our various countries, when we raise issues around social protection, etc., we have a nice wish list, better infrastructure, healthcare, etc. But when we go to governments and we don't specify or we don't suggest how these programs can be funded, they'll remain on paper and, oh, yes, it's good to have, and that's it. And so not just the policy, but the funding at the national level. In a recent conversation in Ghana, there was a conversation around, can we have, from all the taxes that are being deducted, can we have 1% that comes out of a particular tax? So when we make specific suggestions, we're giving policymakers no excuse and a place to start from, because we can ask and we can be told, well, there's no funding available, for certain provisions. So data and funds are the two key things that I'm walking away with. There's the policy, yes, the policy making, and SGA has done a good job of rallying us together. We need to move beyond that to raise data, to buttress advocacy, and then make contributions towards ideas on public funding for programs. And ultimately, two keywords I want everybody to walk away with is partnership and transformation. That's one of the things that I hear across all the conversations and presentations, a partnership through SGA and transformation. So the various initiatives, we do a great job of talking about the gaps across our various countries, whether it's the Gambia, Ghana, Sierra Leone, Nigeria. But then the next move for us is identifying, I think I was listing the things we need to do from one of the slides, setting an objective for who we are. And then beyond this, having very concrete ways in which we engage and build a partnership. And ultimately, if we're working together, we will begin to see the transformation. It may not happen overnight, but we get inspired by what's happening, with Garop, with Dr. MM, and, everyone. And so let's keep inspiring each other. Let's keep learning from each other. Let's buttress our work in data, and let's advocate not just for awareness creation's sake, but let's advocate for proper funding models push the agenda in the interest of older persons. So thank you to everyone who's made time to join this session. Thank you very much.
Thank you so much, SC. We've practically come to the end of our session this afternoon. I see a hand raised up. Sarah Olembo from Nairobi. Are you there? You have 1 minute, sorry, to ask your question. Or is it a comment? Okay, I think she's yes, are you coming on or? Okay. Population in Africa is aging. And since 2020, it's been estimated that by 2050, the 74 million population of older persons that has been recorded will triple to over 235 million by 2050. The journey of 1,000 miles begins with a single step. We've heard a lot this afternoon on the different strategies that we need to embark on. We have a roadmap, basically. But there are also these 3 questions that I would have loved us to debate this afternoon. And if you know that you can give us 1 or 2 tips on how we can move SGA Africa forward, how we can strengthen the participation of members of SGA Africa. Dr. Mokaro touched on the waning interest, and she also touched on a few of the things that, suggestions that she thinks we can carry forward. So if you have any burning tip that you would like to share with us, an idea on, and any aspect of these questions on board, please unmute yourself and quickly, in 1 minute, share that. In the absence of that, can I go around our expert panelists, give us 1 or 2? You can speak to any of these questions. How can we strengthen the participation of SGA Africa? How can we hold ourselves? We are speaking to ourselves. How can we hold ourselves accountable to achieve the action plan and implement them? How can SGA members share their country and regional experiences and data? We've heard a lot about lack of data. How can we ensure that we're able to collate this and nest them and share them? So can I start with our panelist, Dr. Mokaro?
I think I made a few suggestions.
Yes.
What can we do to strengthen the participation of SGA Africa at the African Regional Forum on Sustainable Development? There used to be an annual event up until 2020. So I don't know what happened there. So I want to suggest that, frankly, if it's not too much asking, I'm not speaking as member state, please, forget the flag.
Yeah.
I'm speaking as somebody that has a stake in Africa and somebody that is in this space, elder advocacy space for older persons. So I'm saying that I want to say that the current steering group, taking charge of SGA Africa has been there since 2018. Maybe that's why the waning interest and the tiredness. So I just want to suggest that that steering group could take a decision and step down and let some, other persons take over and, drive SGA Africa at this very critical moment. I want to suggest that they step down. As a matter of fact, I was a co-convener. I was a member of that steering group. And there's even somebody still representing the David Mokaro Foundation there as an institution. So, in fact, I've been appealing to him to step down because, we cannot seem to have a steering group and there's nobody steering anything. And so I really want to appeal, using this forum to really appeal to the current steering group to please do step down. And as it is now, nobody can speak about election because our members do not even know the objective of SGA Africa. We don't even know whether we have a membership registration as it is now. So we need a new set of persons to take over the steering group and then really stay it in, reposition, as we have said, reposition SGA Africa. I'm happy in my head. I still see that road that my brother Shola, from the Gambia put. Yeah. That is the road we are going, and it's a very long road. So we need people, committed, have passion to drive it, are selfless about it, and really know the issues because they are engaging with grassroots, and they can come on. So I would suggest concerning African Regional Forum Sustainable Development Goals, once we have a new steering group, there should be a focal person from that steering group in charge of that to give us information, give us the calendar, liaise with UNECA and see, how they can fund, because I used to get grants for members to attend. I'm sure those things still exist. So there should be a focal person on that. There should be a focal person from the steering group on high-level political forum. We should have a focal person, working with AUC on, operationalizing the protocol. And then we should have a focal person on Human Rights Commission. So if you have members of the steering group all involved and having their portfolios that they are responsible to reporting to, the membership, you see that everything, I think, can go on. And I also want to suggest regular meeting, webinars. We used to have a lot of webinars, like we just had this. What stops us from having this one after we have all celebrated June 15th, the International Network, International World Elder Abuse Awareness Day. So after that, we can have a webinar to compare notes and then have a key message from them, So regular meetings, change of the steering group, focal person within the steering group to man, to focus on the different platforms, to bring reports and all that. I forgot to say a focal person on MIPA as well. So I think I'll stop there. Thank you.
Thank you so much. Mr. Mahoney, any suggestions? Can you speak to any of the questions there in 1 minute? Thank you so much.
No, very quickly, I hear what Dr. had to say, encouraging the existing sort of executive to step down. I was just thinking that that sounded a little bit risky in the sense that the people who are there right now, maybe they will volunteer to be stepping down in due course once they have been able to identify a group to step in. That's all I would say. And by the way, we have 3 hands on board, but yeah, I get the sense that the organization needs to be revitalized and rejuvenated, and it sounds to me as if there are lots of people on this call who would be willing to put their shoulder to the wheel. Back to you, Madam Chair. You have 3 hands up.
Yes. Before then, I would like to go on to Moira quickly. Moira,
okay.
do you have anything to speak to? What are your parting words, your thoughts as we end? We bring the webinar to a close. Moira.
That your 3 questions should be part of the part of the agenda for our next meeting, because all of them so in depth. Yes. Where do we start? We just don't have the time to go into that. But I think a good starting point would be the 16 countries of the African Union who have signed the protocol, and then to make contact with them, to have specific people in those countries, and then spread out from there. But it's we really need to spend a lot of time on these questions, and Dr. has given us an excellent base to work on.
Helen?
I think I would echo what Moira said. I think there's a whole other webinar that could be organised to address some of the questions, and agree that Dr. provided some really practical, helpful suggestions. I think from Garrep's side, obviously, we focus particularly on the question of drafting the new international convention. I will share a link to Garrep's 3-year strategy in the chat for people to take a look at, but we will be looking at work around capacity strengthening to engage with the Human Rights Council and Geneva processes of the UN, and also organising conversations around the content of a new convention. And so it would be wonderful if we could explore opportunities for collaboration there. and work together, because we are stronger when our objectives are aligned and when our approaches and our advocacy is coordinated. So thank you very much for the opportunity.
Yes, thank you so much, Helen. One of the objectives of today's webinar is to strengthen collaboration. So we are looking forward to a more strengthened, a stronger collaboration with GAROP. Essay, quickly, do you have anything to add on to all that has been said with regards to these 3 questions in 1 minute, please?
Thank you. I put my comments in the chat box. I think I'm good. Thank you. Thank you very much.
We have 3 hands raised up, and I don't want to cut off anybody. So you have 1 minute each to contribute. 1 minute. I don't want to have to cut you off. So please, can we be very kind to respect that time? So I'll call on Ibrahim Dania. Please unmute yourself.
Ibrahim is my name. I represent the Debo Bokaro Foundation. I've listened to all the speakers, and without being emotional and or sentimental about the issues raised, as a member of the steering committee representing the Bokaro Foundation, I think I must admit that we are guilty as charged. We have no reason whatsoever, having been in the steering group for the past 4 years and having listened to the objectives for which the SGA Africa was established, without anything tangible to show for the past 4 years. I want to fall in line with the last but one speaker on the need for the steering committee to step down. So I think my take at this point in time is to advise my fellow co-travelers within the steering committee to please step down in the interest of the SGA Africa. This is my take. Thank you.
Thank you so much. We are the voices against discrimination of older persons in Africa. We are the ones that we have been waiting for. Augustine Yaktoma. 1 minute, please.
Okay. Thank you, madam. Thank you, our moderator. I'm Augustine Yakatoma from PHY Mwanza, Tanzania. I would like to talk about the problem of the older people. Actually, the problem of the older people, that's at the grassroots level.
Sorry to interrupt you, Augustine. We just want your contribution to these 3 questions that are on the screen.
Okay.
Yes, please. Is your comment related to that?
Okay. Yeah, my comment is related to that.
I'll organize
and
it.
my contribution, my suggestion is to improve and strengthen our organization at the grassroots level, to have a strong network, national network for the organization which are working in the grassroots level, in order to make sure that you are making advocacy for the older people, because many of the older people who are facing so many challenges, they are at the grassroots level, on the national level, in the village, there, especially on the national level, based on the policies. So if we improve the policies which is working at the national level, it will assist to improve so many things concerning the older people challenges. Thank you.
Thank you so much, Augustine. So we are the ones we have been waiting for. We've also been encouraged to take up a bottom-up approach. So strengthen infrastructure at the national level, strengthen national structures, and then come up to the regional level. So we are the voices against discrimination of older persons in Africa, and that voice must be heard loud and clear. I would like now to call on Mr. Elijah Wenger. Yes, Elijah is the founder of Karika in Kenya. Elijah will be giving the vote of thanks, as well as sharing his suggestions on how to move SGA forward and any aspect of the 3 questions that I had displayed. earlier. So Elijah, thank you so much. Over to you.
Thank you, and hello to every participant. My name is Elijah, as it said, the CEO and founder, Karika Kenya. Karika is an acronym of Kenyan Aged People Require Information, Knowledge, and Advancement. We are also members of Global Alliance for the Rights of Older People, SGA Africa, and currently we are coming up with Kenya Aging Consortium. I want to say older people in Africa deserve quality life. This can only happen if African states put in place legal frameworks that address the issues of older people rights. SGA Africa invited all of us to this pivotal international webinar whose aim is to invigorate the advocacy and partnership for the rights and the inclusion of older persons in all development agendas in Africa. This is in line with Vision 2030, whose clarion call is leaving no one behind. And that is exactly why we are here. We are aiming to position the stakeholder group on aging to deliver and influence the advocacy in Africa. This can only happen if we all put our strengths together, as you have actually done it today. As members of SGA, we wish to appreciate all government representatives who were able to participate with us, the UN agencies representatives, and all the organizations that have participated in this. And we have special thanks to all the members who have participated for the first time in this webinar. Our esteemed speakers, starting with Amol, Tony, Ellen, Sola, Moira, Renada, and Essie. We really appreciate your presentation, which has been very innovative, informative, and I am also happy that Alon from Kenya is interested to join. I would say on behalf of all the hosts, and especially Madam SBC, thank you very much. We are looking forward for more collaborations, and this, as Madam Moira have just said, we are the people we have been waiting for to make African voice for the older people. Thank you for your listening.
Thank you so much, Elijah. And thank you very much to all our participants this afternoon. We will call back on you guys on, on our next webinar. Thank you so much and enjoy the rest of your afternoon. There are a few resources that have been deposited on the chat, so I'll leave that on for a few minutes before closing the seminar in case anybody wants to download or copy anything. Thank you all so much.
Bye.
Bye. And let's continue.
Thank you, everybody.
Thank you,
Bye.
Ellen. Thank you so much, Ellen.
Bye.
Thank you.
Thank you.
Thank you so much.
Bye. Thank you so much, Essie.
Thank you, Moira.
Thank you. Thank
Hello.
Thank you, Dr. Mokara. Good to see
Hi.
you.
So you joined.
Thank you.
Thank you. Bye,
Join
everyone.
SG Africa.
Bye.
Love you
Thank
guys.
you.
Bye-bye.
Yeah,
Bye.
Thank you. Bye.
Thank you, Beta. I see Beta. Essie, thank you so much. Bye.
Thank you all. God bless you. Bye.
Thank you.
Bye-bye.
Elijah, bye.
Not ending.
Yes, the recording will be made available. Yes.
Bye-bye. Bye-bye.
Rosemary.
Imagine. vijana.